Hello, everyone. So this month, I'm answering your most common questions about high blood pressure. We're going to be talking about how to check it properly. We're going to talk about why the numbers seem to change and whether you can get off medication and much more. But today, we're going to be starting with the most important question, which is how do you even know if you have high blood pressure? And, you know, a lot of people don't know, unfortunately. And that's because blood pressure, a lot of times, high blood pressure, a lot of times does not cause symptoms. And it is dangerous, though. And so that's why we need to keep talking about it. So, if you already have high blood pressure, though, and you know it, and you're wondering about natural ways to treat it, we also have something for you. So, keep listening. Okay, so before we get started here, I am Dr. Lola Ashaye. I'm a board-certified family medicine and lifestyle medicine doctor, and you're listening to Connecting the Dots with Dr. Ashaye, which is a great place to be if you desire to take charge of your health so that you can live fully while enjoying doing what you love. All right, so why high blood pressure? Well, high blood pressure is a silent killer. And in the US, nearly half of all adults, that's about 120 million people, and that's probably old data by now, you know how things change so rapidly. But let's say nearly half of all adults have high blood pressure. And the part that is most bothersome is 1 out of 3 people don't even know it, right? And that's because many people with high blood pressure, like I mentioned earlier, they don't have any symptoms. They feel fine. And so it's not until they go to the dentist or they go to, their doctor's office for a physical, or they need, to check their blood pressure for one reason or the other, for maybe an application or something. And then they find that their blood pressure is high, and they may not know how high that it's been high for a long time. The problem with that is even though you don't know, it has already put a lot of pressure on your organs. So if you think about your blood vessels like a garden hose, right? And if you crank up the water pressure too high for too long, after a while, that hose starts to wear down. It starts to get stiff, it gets cracks, even bursts. And that's exactly what happens to your arteries when you have high blood pressure. And so that's why it causes heart disease, which is the #1 cause of death in the US. It causes strokes, it causes kidney failure, which is why some people, high blood pressure is actually the leading cause of dialysis. It causes dementia. So studies show that people with uncontrolled blood pressure between the ages of 44 to 66 are at higher risk of dementia later in life. So it has real consequences. And so it needs to be addressed. So how do you know if you have high blood pressure? Well, you check it, right? So you have to check. There's just no other way. And there is a right way and a wrong way to check. And it needs to be done the right way so that the results are accurate. But before I go into how to make sure the results are accurate, if you have found this video helpful or other videos helpful, please go ahead and subscribe. That way you stay updated. That way other people know about this information. That way you can follow. It's easier to follow our tips and take charge of your health. And, I'm really excited to keep supporting you on your journey to a healthier you. So let's get into how to check blood pressure properly. And this is really important because unfortunately, even in health facilities, oftentimes the way blood pressure is taken is not correct. So the reason this is important is if you think about it, the blood pressure values that we're comparing to, that we're saying your blood pressure is supposed to be this value, is based on checking your blood pressure a certain way. So if you check your blood pressure different from the way that the people that came up with these numbers have checked it, you're going to get different values and they will not be accurate. And so the comparison will be wrong. So it's really important because blood pressure is fickle. There are many different things that affect our blood pressure. So if you're not checking it under the right conditions, the numbers you're getting are not accurate and they're not useful. So how do we check it accurately? First step is you want to sit still while you're checking your blood pressure. You shouldn't be excited. You shouldn't be talking. You shouldn't be moving around. You should just be calm, quiet, and sitting still. And you want to try and sit still for about 5 minutes. Yeah, about 5 minutes. It takes some time for you to calm down and to be still. Second thing is you want your feet to be planted flat on the ground. So you don't want to be crossing your legs. You don't want your feet on the bed. You want to be seated with your feet planted, supported on the ground. The other thing is you want to make sure that your back is supported. So you want to have a chair that has a back. So you don't want to be on a chair, on a stool while you're checking your blood pressure. You want to sit on a chair that has back support. And then you want your arm to be at heart level. So if you sit on a dining table, on a dining chair, that pretty much is the position. So you sit it down on a dining chair with the back support and your arm on the dining table. That will be perfect. And then you want to check both arms. So yes, a lot of times the blood pressure is going to be different, a little bit different in both arms, and that is completely fine. There are conditions that the blood pressure is completely different, which, we're not talking about today, but generally speaking, it will be different, and that's fine. What you want to do is once you identify the arm that has the higher blood pressure, that's the arm that you keep checking in going forward. Okay, so you identify, you check both arms, you do that for a while, and if every time you check your left arm is a little bit higher than your right arm, then go ahead and check, keep checking with the left arm. If both are usually about the same or it doesn't make sense, sometimes one is higher, then it doesn't matter. Just check with the arm you like or don't like. Okay. All right. And then the important thing is you need multiple readings, right? So one reading is not enough to determine whether or not you have high blood pressure. What we want is a few readings, usually about 14 readings in a month. That will give us a great idea about what your blood pressure is doing in a good amount of time. So you can do that by checking your blood pressure daily for a week, or you can do it by checking your blood pressure twice a day for a week, or once a day for 2 weeks, and that gives us 14 values. So if you're going to check about the same time, so say you check the blood pressure and you've noticed that after a while, if you check again, 1 to 2 minutes later, you check again, it's different, go ahead and write both values down. And wait about 1 to 2 minutes between checking, though. Don't check every 30 seconds. Okay. So there are certain things that you should avoid before checking your blood pressure. And there's a number of things, I have a handout about this, but I'll highlight some of them. Caffeine is going to affect your blood pressure. Cigarette smoke is going to affect your blood pressure. Exercise is going to affect your blood pressure. So you want to wait at least 30 minutes after engaging in any of those things to check. So I hope, that gives a good idea of how to make sure it's accurate. And by listening to this, you've probably figured that a lot of the places where you go, many of those conditions are not true. So your blood pressure is probably not accurate, which is why having your own home blood pressure machine is really important, because that's where we're most likely to get accurate results at home in your natural environment. And if you already have high blood pressure, it's helpful for you to bring in your blood pressure monitor to your doctor's office. So that's what I do with all my patients. If they have high blood pressure, I encourage them to bring to our clinic. We have a clinic InTouch Primary Care in Sugarland, Texas. And I ask them, I say, bring your blood pressure with you the next time. Let's compare what we're getting here to what you get when you have your blood pressure here. And then that helps them feel reassured that their blood pressure machine is doing what it needs to do. Okay. So I'm going to address this too, though, because there are some people that checking their blood pressure gives them anxiety. Every time they're about to check their blood pressure, they feel stressed and the blood pressure is high. So this can happen. And it's important that for those types of people, you may not want to check your blood pressure all the time, right? Because if a lot of times those people would check their blood pressure multiple times a day, and it just makes them feel anxious every time they check. What I'll recommend is, number one, if you are like that, try to check your blood pressure about the same time every day, but just once a day. Okay. And then don't get overly focused on one single number. Try to check, look at the trend, not just the one number. And then lastly, try to relax before measuring. So you can do deep breathing, you can play relaxing music, do whatever you can to try to get yourself to relax before checking your blood pressure. But for people that have anxiety around checking their blood pressure, some of them may not need to check their blood pressure at all. Just, come to your doctor's office and have your doctor check it for you if they can get you to have that kind of condition, if you feel, more comfortable there. And I do have some patients like that who actually feel more comfortable because they feel reassured when they come in the practice. They know they're going to be cared for. And so, while we're here, we make them laugh, we make them relax, and then, we get better readings than they will get at home when they constantly check their blood pressure. Okay. So, like I mentioned earlier, some of you already have high blood pressure, you know it, and you're interested in learning not only about, how to check it, but what you can do for it. And so we've put together a list of supplements that can be helpful to lower blood pressure. And not only that, we also have information about how you can make sure you're getting high quality supplements. So if you are interested in that information, there is a link in the video, in the caption. Go ahead and click on that link and we will be able to send that handout to you. Okay, so let's recap. So high blood pressure has no symptoms. So the only way to figure out if you have it or not is to check. And that is so important. Secondly, make sure you're checking correctly. There's no point having values if we can't really compare them to what are the, standard values. So please go ahead and check correctly. If checking it stresses you out, don't overdo it. Once a day, maybe once a day for a week in a month. And then take your values to your doctor, maybe have someone else check it for you. Try to make sure that you relax, but just don't get caught up in checking your blood pressure all the time and stressing yourself out even more. All right, I hope that has been helpful. Go ahead and drop comments. Remember to subscribe. It really does help us. And next episode, we're going to be tackling why does your blood pressure keep changing all the time? And what do you do about that? And remember, if you are planning on using supplements, always, always, always talk to your doctor first before adding any supplements, especially if you're taking medication. So don't just start buying things without checking with your doctor first. Supplements can affect your blood pressure, can affect your health, and it's important to make sure that you're taking the right ones. All right, that's all we have for today. Have a great day, and we will see you next time.